I'm Dr. Cyndi Torosky. We're going to be doing lip filler this afternoon on Lauren. So she has already had her topical numbing applied for about 30 minutes or so. We're going to get started. The lips are one of my favorite areas to fill. They're one of the areas that can make a really big difference in rejuvenating the face. They're also one of the areas when it's done improperly can look very unnatural. And a lot of my patients have a lot of concern about that unnatural look. But when it's done well, it really can give a nice natural plump and pouting to the lip. So it's very important to address all the anatomy of the lip. We have the body of the lip, we have the vermilion border, which is where the color of a lip transitions into the skin part of the lip. Above that is called the white roll. So some people need us to accentuate that, other people's don't. If you put too much in that area, it actually will give you that duck lip, which really is not desired by most of our patients. And then we also have the filter columns, which are the columns that extend from the nose down onto the lip. That is an area that is often forgotten when people have lip filler, but it's one of the structures that gives us a more youthful appearance. So we'll be addressing those on her as well. So we're going to get started, okay?
All right.
Like I said, she has been numbed. I kind of tell patients they're still going to feel a little bit of a pinch and pressure of the product going in. So here we go. Key to injecting lips is making sure that you go nice and slow and watch what volume is going in. The lips do tend to swell a little bit more than some other areas, so you want to be sure that you're not chasing that swelling. You don't over inject the second area you go to match the swelling of the other side. How you doing?
I'm good.
And I give that side a break for a minute. We do mold the product to ensure it's right where we want it to be, but we don't have patients move this product around. Now I'm going to address that filter column on her upper lip. This is a little bit more of a zing, so I always warn patients of that. Doing okay? Mm-hmm. You are doing great. The lip area is an area that is particularly prone to swelling, so I always warn patients of that. Typically the swelling sets in shortly after injection and then can increase over 24 to 48 hours. So it's an area that it's important to ice. So I have patients ice a couple times the day of treatment and then a few times the following day if needed. But it typically resolves in most patients within 2 days. So as far as scheduling, I always have patients plan for that. Now we're going to get started on the lower lip now. The aesthetic ideal of the lip is for the lower lip to be slightly larger than the upper lip. Social trends sometimes change, and right now some patients are wanting a larger upper lip, but the ideal structure should be the lower lip being a bit larger. Doing okay?
Yeah.
It's also very important to watch her needle placement. Right where I'm at right now, she's got a little blood vessel on the lip, so I'm trying to stay under that because if you hit a natural vessel, you're going to get more bruising, and we missed it. Doing okay? And then lastly, we're going to put some at the corners of the mouth. This really helps the angles of the mouth to lift up. Many people will get that downward turning of the mouth over time, and this will help lift that up. And you can see she is getting a little bit of swelling. This is going to go down, so I always warn patients not to get too worried those first few days. All right, little pinch right at the edge. Beautiful. The type of filler that we select is really patient dependent, depending on how much volume we're replacing. Some patients really just need more of a hydrated look. Some people need more volume or structure. So it really is catered to the individual. All right. So we are done with Lauren's injection. You can see she's very comfortably icing right now. So if you are interested in getting your lips treated or learning about any of the cosmetic services that we offer, we do have cosmetic consultations where we can set up a really customized treatment plan for you. Call 622-6315 to set up that consultation.